Hello and welcome to Acupressure Wednesday. Thanks for joining us. I'm Alexa Hulsey, licensed acupuncturist and owner of Encircle Acupuncture in Nashville. And today is Wednesday, so we're going to do some acupressure. Today we'll be doing acupressure for headaches, something that a lot of us are dealing with right now. Acupressure is a great way to just help manage headaches and to give you some symptomatic relief of headaches. It's really easy to do. So I'm going to show you a few techniques today that I hope will be helpful. So thank you so much for joining us. I'm just going to talk. If you're having trouble hearing me, just say so in the comments and I will do whatever I need to do to adjust the volume accordingly. But let's go ahead and get started. So like I said, we're going to be doing acupressure for headaches today. And so we're gonna do acupressure for various types of headaches. Some headaches are really location specific. Other headaches are just sort of diffuse. I'm going to show you techniques for any kind of headache that you're experiencing, regardless of the cause. Acupressure is a great way to just manage the symptoms. So thanks for joining us. I'm going to get started first with a couple of exercises just to get us settled into our bodies and ready to do some self-care. So we'll start first just comfortable seated position and make sure your feet are flat on the floor, and we'll just take a few breaths. You can keep your eyes open if you like. You can close your eyes, whatever you want to do. Just sit comfortably and take a few deep breaths and just tune into your body. See what's going on in there today. Maybe now is really the first time you've even checked in with your body today. See how you're feeling. Are you having pain anywhere? Are you holding tension anywhere? Is your mind racing because you've got a lot of stress? Just take a minute to just breathe through all of that. I'm going to close my eyes and take a few breaths. Just be aware of anything that you're feeling. We'll check back in with our bodies at the end of the acupressure session and see if anything has changed. Also, so the next thing we're going to do, I like to do a little gathering chi exercise before we do acupressure. It just helps to make our session a little more productive. So you can do this exercise either sitting or standing. And I'm going to stand up for this. And you're just going to either sit or stand with your feet on the floor about hip width apart. And you're going to take a deep inhale as you raise your arms overhead, palms up. And then as you exhale, you're going to lower your hands, palms down, and bring those to your lower abdomen. So just do that a few times. Inhale deeply, palms up, arms overhead. And exhale. Bring your palms to your abdomen. Let's do that one more time. Inhale. This lower abdominal area, we call that the lower dantian, and that's one of your lower centers of energy. So it's nice to bring your energy into that area, and really helps it concentrate in your core. And then finally, let's just rub our hands together and get some chi circulating out to our fingertips and to our palms, since we'll be using our hands with acupressure today. All right. And your hands should feel nice and tingly, be nice and red after you're done with that. Okay, so if you're just joining us, welcome to Acupressure Wednesday. We're talking about acupressure for headaches today. And I'm going to show you some points that can treat headaches in any general area on the head. And then I'm also going to show you some location specific points. So if you tend to get headaches just in one area, like behind your eye, then I'll show you some specific techniques that you can do for headaches in a specific area. Okay, so first of all, I'm going to show you a point that you might already be familiar with. This is large intestine 4, and it is located between the thumb and the forefinger right here. The way that you find the exact location of the point is that you squeeze the thumb and the forefinger together, and then at the sort of highest fleshy area between the thumb and the forefinger, that's the specific location of large intestine 4. But this is a point that is pretty, sort of covers a large surface area. So don't worry about finding the textbook location of this point. What's most important is to find a spot where you feel some kind of response from your body. Maybe it's a little bit sore when you press on it. Maybe you feel some sensation moving up your arm. Those are signs that you are in the right spot. Now, a quick note, this point is contraindicated for acupuncture in pregnancy. So if you're pregnant, you're going to skip this point. I'll show you plenty of other points that you can do. So skip this one for now. And with large intestine 4, you can just squeeze with your thumb and your forefinger like this. You can rub in circles. You can use firm pressure. You can use medium pressure. It's really what feels good to you. So you don't want to squeeze or press so hard that it's painful, but you want to feel something. You want to feel a little kind of message from your body saying, yes, this is the correct point. So you can just kind of alternate back and forth between large intestine 4 on each hand. All the points are bilateral, so you don't have to focus so much on which side of the body you're using. And I'll talk more about which side to use based on the location of the headache. In general, if you have headaches that are one-sided, you want to use the location-specific points on the same side as the headache, and the more general points on the opposite side. So if you have headaches behind your eye on the right side of the body, then you could do large intestine 4 on the left side, and then the location-specific points on the right side, and I'll show you those. But don't worry about that so much, about trying to remember exactly which side you should use for which points. Just concentrate on getting a response from your body. All right, so that's large intestine 4. It is the most important point for anything affecting the head or the sensory orifices. So really anything from the neck up, large intestine 4 is a great point for that. It really strongly moves the chi in your body. So it's an excellent point. Another point that is a general headache point is Sanjiao 5. And this one's located on your forearm. So the way that you locate Sanjiao 5 is with your palm facing your chest, and it's located in this, there's sort of a trough between your radius and your ulna, the 2 bones of your arm. So it's right in between, and you can even kind of see a depression there. That's the Sanjiao channel. And the point Sanjiao 5 is you're going to take your 3 fingers from your other hand and measure about the width of your 3 fingers from your wrist crease. So take your 3 fingers, and right about there is Sanjiao 5. This is a strong point, so feel around and find a spot that feels tender. That's how you know that you're on the point. And again, you can do this on both sides, so I'll kind of alternate sides while I'm talking. Sanjiao 5 is an interesting point. It's what we call a confluent point. And, ooh, this is really tender on this side. Way more tender on this arm for me than my left arm. So it's interesting to take note of those differences. It's way more tender on my right side. That's generally just a sign of imbalance in the body. So Sanjiao 5 is especially good if you are experiencing headaches due to some sort of external factor. So maybe you're having headaches due to allergies, or maybe there's something in your environment that you're sensitive to that's causing headaches. Sanjiao 5 is a really great point to do for that. Now, in general, the points that we are using for headaches and acupressure for headaches is is what we call a branch treatment. So in Chinese medicine, we look at disease in terms of roots and branches. And the roots are the causes of disease, and the branches are the ways that disease manifests in our body, so the symptoms. So headache is a branch. It is a symptom of some other kind of imbalance in the body. With acupressure, with today's acupressure for headaches, we're really just working on the branch. So we're treating the headache and providing some symptomatic relief, but we're not actually working on the underlying imbalance. We're not working on the root of the imbalance with today's acupressure, but we will give you some symptomatic relief, which is a good thing. But if you have persistent headaches that really aren't resolving, then you should see an acupuncturist, and they can work with you on the root treatment and prevention so that those headaches go away and don't come back. That's one of the beauties of acupuncture and traditional Chinese medicine. Okay, so Sanjiao 5 and large intestine 4, these are our two general points on the upper body. And then I'm going to show you 2 points on the foot as well. Headaches in traditional Chinese medicine are usually some type of excess yang rising up to the head, and so we want to bring that down. So I generally start at the top and work my way down when I'm working on headaches, because we want to kind of have a descending action. So that's why I did these 2 points on the hands first, and then I'm going to show you 2 points on the feet too. Again, these are the general points for any type of headache. So, 1 point is liver 3. This might also look familiar. We use this point very frequently in acupuncture. And liver 3 is very similar anatomically to large intestine 4. Large intestine 4 is between the thumb and the forefinger. Liver 3 is between the first 2 toes. And, well, really between the first 2 metatarsals. So you're going to, between your first 2 toes, just sort of trace back towards your ankle, and there's going to be a depression right before your 2 metatarsal bones join, and that's liver 3. Again, feel around for a tender spot. Liver 3 has great strong action for descending excess yang from the head. So I pretty much always use this point when I'm helping someone with headaches, because it can work for any type of headaches, and it has that really strong descending action. You can rub liver 3 in circles, or you can sort of do a stroking type of technique towards the toes, because another point on the liver channel, liver 2, is right here, right between the toes. And liver 2 also has a strong descending action. So if the headache is really severe, or if the headache is accompanied by anger or irritability, just feeling hot-headed, or maybe dizziness, then sort of move your thumb or your finger along the channel, and that's going to help guide the excess yang out of the head. So that's a really effective technique if the headache is severe or it involves some other symptoms. Liver 3 I'm going to just switch sides. Liver 3 also benefits the eyes. And so if your headache involves maybe blurred vision, or seeing floaters in the eyes, or light sensitivity, then liver 3 is great. And it's also great to move towards liver 2. Again, that helps to just really bring down that excess yang energy from the head. So that's liver 3. And then our final general point for headaches is gallbladder 40, which is located on the side of the foot. Right here, so you're going to find your outer ankle bone here. Just go a little bit down and forward, and there's a really deep depression right there in front of your ankle bone. And that is gallbladder 40. And gallbladder 40 also has a strong action to bring down excess yang from the head. The gallbladder channel is really interesting. It has 43 points on it, and almost half of the points are on the head. So the gallbladder channel begins at the corner of the eye, and then it zigzags back and forth across the head. So the gallbladder channel has a lot to do with the whole side of the head. So this is really good for headaches in the temporal region or on the side of the head. Also, just for overthinking and thoughts that feel like they're sort of zigzagging across your head. Gallbladder 40, I'm just going to switch sides here. Again, we're going to go find the ankle bone, go down and forward into that nice deep depression. This is one of my favorite points for doing acupressure on myself. I just find that it feels really therapeutic, and I just instantly relax when I do acupressure on myself on this point. Gallbladder 40 and liver 3, which we just did, these are also excellent points for stress. Stress is often a factor with headaches, so if that's the case with you, you want to just spend a little extra time on liver 3 and gallbladder 40. They're great points for stress and headaches. Okay, so those are our general points for headache. Large intestine 4, skip this one if you're pregnant, Sanjiao 5, liver 3, and gallbladder 40. So now I'm going to talk about some location-specific points. And so what we're going to do here, for each location, I'm going to give you a local point and then a distal point. So a point on the head and then a point farther along on the body to descend that energy. And I should have told you at the beginning, we're going to be touching our faces, so you want clean hands. I got some hand sanitizer. I'm going to give myself a little squirt here, and if you don't have clean hands, go take a minute to wash them real quick for 20 seconds or get some hand sanitizer because we will be touching our faces and we need to have clean hands when we touch our faces. Okay, so we're going to start with headaches that are either in the temples, on the sides of the head, in the forehead, or in the eyes. So this is a lot of headaches, especially migraines, which tend to be one-sided and are often behind an eye. This involves the gallbladder channel, which we were just talking about. Because the gallbladder channel, like I said, it starts at the outer corner of the eye and then it zigzags back and forth across the head. So the local point that we're going to do is right here. It's called Tai Yang, and it's really just the center of the temples. There's a depression there. So feel around and find the depression. That is Tai Yang. Sorry, yes, that's Tai Yang. It's a very effective point. I mean, most people, a lot of times when you have a headache in this area, you're just going to naturally massage this area because it feels therapeutic. You can massage in circles. That's what I usually do. Some people like to just press. Do what feels good for you. I like to massage in slow circles. The slow circles have a more sedating effect. If you massage vigorously and like rub in fast circles, then that tends to stir things up more and bring more yang up to the head, which we don't want to do. Slower circles have a more sedating effect. So this is just going to disperse any kind of stagnation that's anywhere in this area, the temples, the sides of the head, the eyes. Tai Yang is also a good point for the eyes. So for blurred vision, light sensitivity, things like that. So you'll just take a couple of minutes to do that. If your headache is one-sided, then just do Tai Yang on the affected side. You don't have to do both sides, you can, but you can just do Tai Yang on the affected side and then do some of the general points on the non-affected side. So that's our local point for any headaches on the side or the temples or the eyes. You can also use this for the forehead too. And then I'm going to show you the location specific point. This is another point on the gallbladder channel. And this is gallbladder 43. I think I said earlier that the gallbladder channel has 43 points. I was wrong, it has 44. So we're going to do gallbladder 43, which is the second to last point on the gallbladder channel. And it is located between the 4th and 5th toes. And right where those toes meet, right there where those toes meet. So a really effective technique for this one is to use your fingernail or your thumbnail and just really get in there and apply some strong pressure. It might feel a little uncomfortable, but that's okay. I mean, don't draw blood or anything, but it's okay if it feels a little bit uncomfortable, because that's really going to have a strong descending action coming down from your head. So what I would do for a headache affecting the side of the head, you'll do your point up on your temple, do gallbladder 40, rub that in a few circles, because that's going to help bring that excess energy down, and then really apply some strong pressure with your fingernail at gallbladder 43. So that's going to have a really strong descending action. If your headache is one-sided, again, you only have to do the affected side. You can do both if you want, but it's not necessary. Just focus on the affected side with these location-specific points. So there's gallbladder 43. Kind of tender on me. All right. So the next area we're going to cover, headaches affecting the face. And this is usually or often due to some kind of allergy. I'm going to use my hand sanitizer again since I was touching my feet. They're clean, but you know, it doesn't hurt to use some hand sanitizer again before we touch our faces. So I'm actually going to show you a couple of points on the face for headaches affecting the sinuses. So really anything like underneath the eyes and the cheeks. This is going to involve the stomach channel. The stomach channel begins at the side of the nose, and it comes up under the eye, goes down, and then back up here. So the stomach channel also involves the jaws. So if you have headaches coming from TMJ, you're also going to use the stomach channel. So one location-specific point that you can use is yin tong, which is right here. Even though that's not technically on the stomach channel, it's a really good point for, I mean, you can use it for any type of headache. But it's great for headaches that are affecting the face. And then here underneath your eyes, you've got stomach 2 and 3. So the stomach channel just descends directly below your pupil. And so just feel around. If you find a tender spot, just press. You don't need to apply a lot of pressure on your face. Just apply a little bit of pressure. And then you can try to take some deep breaths, especially if you've got some sinus congestion. Just take some breaths while you're applying pressure. And that helps to disperse that stagnation in there. It feels really good. This is great to do even if you don't have headaches and you just want a little help breathing during allergy time. Just feel for those tender spots. All right. And then the distal point we're going to use is on the stomach channel. And that's going to be on your foot also. So the point that we're going to use on the stomach channel on the foot is stomach 44. And that is located between the second and the third toes. So gallbladder 43, which we did for temporal headaches, is between the fourth and the fifth toes. Stomach 44 is between the second and the third. And again, right where those toes meet. So same technique. You can press with your fingernail and you're going to feel a pretty strong response. So like I said, the stomach channel begins at the side of the nose, descends below the eyes, goes through the jaws, and then it descends all the way down to the toes. You'll notice that a lot of these distal points that we're doing are around the toes. In general, the farther away from your head, then the stronger the descending action is going to be. So that's why we use these points that are so far down on the toes, because they are some of the strongest points to really bring down that energy from your head. So stomach 44 is right here. A lot of these points are tender on me today. I don't really have a headache, but tenderness at the site of an acupuncture or an acupressure point is just a sign of imbalance in the body, so it's good to pay attention to. All right, so those are facial or frontal headaches. And then finally, For those of you who have occipital headaches or headaches here at the back of the head or the back of the neck, I'm going to show you some spots for that too. So we're going to do a point called gallbladder 40, which is back here. I don't know if you'll really be able to see it on me. I'll try my best. So it's right here at the base of the skull, and there's a depression right on both sides. There's a depression at the base of the skull. Again, I say this a lot, but just feel around for a spot that's tender. And this is a great one to just rub in some circles. Gallbladder 40 is also great to use if you have a stiff neck or neck and shoulder tension. You know, a lot of us walk around like this with our neck and shoulders way up here. Gallbladder 20, helps to release that muscle tension, and very good for occipital headaches. So you can just rub in some circles there. And then the distal point that we'll use for occipital headaches is another point on the around the ankle. So this is going to be on the urinary bladder channel, and this is urinary bladder 60, and it's close to gallbladder 40. So here is the ankle bone, your outer ankle, and you're just going to go a little bit posterior. So it's kind of between your Achilles tendon and the ankle bone, and tender. Find a tender spot. So this is urinary bladder 60, and so here's UB 60 and here's gallbladder 40. They're really close to one another. Now, urinary bladder 60 is another point that is contraindicated for acupuncture in pregnancy. So if you're pregnant, skip urinary bladder 60 and just do gallbladder 40 instead. Just spend a little extra time there. So with urinary bladder 60, you can squeeze, you can do the fingernail thing, you can rub in circles. Again, whatever feels kind of most therapeutic for you. And just spend a little bit of time doing that. You can do both sides. You can kind of try to do urinary bladder 60 and gallbladder 40 at the same time. That feels really good. It's like you're giving yourself an ankle massage too at the same time. So that's just a bonus. Your ankles will feel great after this. And again, it's all about what does your body respond to? What feels best? What feels therapeutic? And that's one of the things I love about acupressure and self-acupressure, because it really helps you to tune in to what your body is feeling and what feels like self-care to you. Earlier when we were doing Sanjiao 5, this was really tender on me on this side. It might not be on you. So if it's not, then you don't have to spend as much time massaging it. I should spend more time because it's still sore on me. You can really direct your own self-care through acupressure, and that's one of the beauties of it. So let's take a few minutes now, and we'll just sit comfortably, breathe comfortably, feet planted on the floor, and just tune into your body and see if anything feels different. And I'm just gonna close my eyes for a couple of breaths and do that. And you can close your eyes or leave them open, whatever's comfortable. All right, well, I hope you're feeling a little better after this acupressure session. Thank you so much for joining us. We're here every Wednesday at noon Central Time. If you have any questions about acupressure, if you have suggestions, we've gotten some suggestions already, and we're going to be working those into our schedule. So thank you so much to those of you who have reached out. We're here for you. We love acupressure, and we hope you do too. So thanks for joining us. Thanks Tea and Tantrums. Thanks Suze. Love you too. And we'll see you soon. Have a great day, everybody. Bye.